My name is Jim Krause, and this is one in a series of videos that summarize research results from our program of outcomes research with spinal cord injury. What I'm going to talk to you today about is the measurement of depressive symptoms during inpatient rehabilitation for spinal cord injury, and then follow-up measure 12 months later post-discharge, or about 15 months post-injury. We used the Patient Health Questionnaire 9 at both inpatient rehabilitation baseline and outpatient, and we separated symptoms using factor analysis into two groups, one being somatic content, which would be sleep loss, appetite change, and fatigue, and then non-somatic items such as the feeling of depression or loss of interest in other activities. And so the diagram that we have on the board tracks the correlations at baseline and 1 year follow-up between the somatic symptoms and the non-somatic symptoms. I would like to draw your attention first to the vertical line from the upper left-hand box to the lower left-hand box. And it reports the correlation between non-somatic items at baseline and somatic items at baseline. And it's 0.24, so they are not very highly correlated, but they are modestly correlated. If you draw your attention now to the other end, you can see the non-somatic items at year 1 are correlated 0.39 with the somatic items at 1 year. So at the 1 year follow-up, the two item domains, or the two separate indicators of depression, are modestly correlated, more highly correlated than they were at the baseline itself. Then if you now look at the horizontal line from the upper left-hand corner, the non-somatic items at baseline with non-somatic items at 1 year follow-up, the correlation is rather high, 0.67. This indicates that non-somatic items or affective items at baseline are very predictive of the similar items at 1 year follow-up. Now if you draw your attention to the bottom of the graph, you will see that somatic items at baseline are only correlated plus 0.10 with the same items at follow-up. This correlation is non-significant, meaning that they're essentially not correlated even with the same items between baseline and follow-up. Now the two diagonal lines are of great significance. The first diagonal line going from upper left-hand corner to bottom right-hand corner shows that the correlation is 0.53 between non-somatic items at baseline and somatic items at follow-up. And what this means is that non-somatic items are significantly predict somatic endorsement of somatic complaints at 1 year follow-up. On the other hand, somatic items, the bottom left-hand corner, at baseline, again, are essentially unrelated to non-somatic items at 1 year. So in terms of using this information, rehabilitation professionals and rehabilitation psychologists need to be aware that measuring somatic items in people with SCI during baseline or inpatient rehabilitation will have little or essentially no predictability of similar items or non-somatic items at follow-up. By using non-somatic or affective items during inpatient rehabilitation will significantly predict not only the same items at follow-up, but also somatic items at follow-up. Therefore, for the purposes of clinical assessments, there clearly needs to be extreme caution used when interpreting somatic items during inpatient rehabilitation, specifically sleep loss, appetite loss, and fatigue, whereas one might use the non-somatic or affective items and know that they will be predictive not only of similar content at follow-up, but also somatic indicators of depression. Thank you.